why is the development of evidence-based guidelines and adherence to these recommendations so important? And I'm sure, as many of you have heard, that there's skyrocketing use of imaging for low back pain, and yet we have a significant volume of research that demonstrates a high percentage of low back pain imaging exams performed, again, really are not adding value to patient care. And specifically, we know that the majority of back pain symptoms will resolve within the first 4 to 6 weeks with just minor interventions such as applying heat, over-the-counter medications, or perhaps physical therapy. So I think that's what brings us all here today, is to consider and discuss solutions to overutilization of imaging for low back pain. And just to consider some of the many costs related to unnecessary imaging, and I think costs other than maybe just the dollar costs, such as needlessly exposing patients to radiation. And while, for example, a CT of the spine, the exposure is modest, it's still an important consideration. I think, for example, the amount of radiation exposure that adult experiences for a CT scan of the spine is approximately comparable to 2 years of radiation that you would normally experience just in the natural background. So if it's needed, certainly that's reasonable. And if it's not, obviously that's radiation that you want to avoid. But I think particularly a more significant issue is the prospect of finding abnormalities on an imaging exam that aren't really related to the condition for which an exam was ordered, and oftentimes really mean nothing. And these incidental findings have grown in number related to the significant increase in the utilization of CT exams, and also due to the technology's improved image quality. And these incidental findings can lead to increased risk to the patients from additional downstream unnecessary procedures. And that kind of leads to the specific dollar cost related to performing tests. I mean, there's the cost of the tests, but there's also, patient deductibles, other out-of-pocket costs, having to take time off of work, transportation, maybe having to arrange for daycare. So really the cost is well beyond just that cost of the specific exam. And I think for many patients, there's an emotional cost due to test anxiety. For example, patients who are claustrophobic and have to endure an MRI exam. As I mentioned, research has shown that oftentimes when back pain resolves within 4 to 6 weeks. And I think in the previous slide, actually, it just kind of a list of here are the circumstances when you would not necessarily want to order an exam. And what we're looking at now, of course, there are times when an imaging exam is exactly what is needed. And while there's no official medical definition for what constitutes a red flag, the types of conditions that are listed on this slide make up the most common symptoms for when an imaging exam for low back pain should be ordered without waiting.